Evening, everybody, and welcome to the February Conversation with a Doc. Tonight we have Dr. Stephen Grill, and he's going to talk about what's probably a difficult subject, but very necessary and very worthwhile to understand, and that's about driving. And I'm going to just turn it right over to him. Okay, Dr. Grill,
Okay.
you're on.
All right. Well, thank you for inviting me to the MAPS. I think I was here maybe a year or so ago. And we're going to talk about driving, which is a real issue that we all need to face, frankly, as we get older. So so we'll get started. I'm going to share my screen. Let's see if the technology works. And let's see. And let me go back. Okay, can you see my screen? We're all good? Okay. Okay, very good. So let's get started. So again, the topic today is driving with Parkinson's disease. And so just sort of an outline of what we'll talk about. One thing we have to face is that people with Parkinson's do have an increased risk of having impairment while driving. So we have to recognize that. And I think all of us would agree that if you're not safe to drive, you shouldn't, right? So the question is, how do we evaluate whether you're safe to drive? How do we know whether you're safe to drive? And we'll go over that. And then also to understand that there are alternatives to driving, that if you can't drive any longer, there are alternatives, and we'll go over some of that. But one thing to understand is that a car crash can, hold on. A car crash can be traumatic. A 40-mile-per-hour car impact is like driving off of a four-story building. Okay, so really understand that, these cars, they weigh thousands of pounds. We all, we've driven since we were 16 years old, and we don't, maybe acknowledge that as we get older, our skills may start to deteriorate. So, but it's a real heavy machine, and it's so powerful, and we sort of take it for granted that we're not going to have an accident, or we don't think we're at risk, but we really are. Okay, so this is a list of the symptoms that I made up in Parkinson's disease. And this lists all the motor and non-motor symptoms, or almost all of them. And, this is not to be a scary slide. You should understand that not everybody gets all the problems, but these can come up. So if we think about the dysautonomic problems, and look at this list and think about which of these symptoms could impair your driving. So I'm not sure constipation can, but urinary problems can. If people are having urinary urgency and you're driving and there's no bathroom in sight, that can lead to some erratic driving. Low blood pressure or orthostatic hypotension, if you're starting to faint as you're driving, obviously that's a risk factor. Surprisingly, falls and balance problems are also a risk factor for driving. So, if you have a lot of imbalance, that might be a clue that your driving may not be so great. Motor fluctuations, motor complications, if you're fit to drive when you're in a good on state, but if you have a lot of motor fluctuations where you're in an off state, and sometimes people can be suddenly in an off state, then that's a real risk. If the off periods are unpredictable, then you could be driving and all of a sudden you can be in an off state, or you could develop dyskinesias, which can interfere with your ability to control the steering wheel and the gas pedal. So those are risks. And then the neuropsychiatric problems. So if you have significant cognitive impairment or dementia, then you may be confused driving, and you may get lost, and you may get confused about how to handle the car. If you have psychotic features like hallucinations or delusions, you may, what happens if you have a hallucination of something in front of your car? You may swerve to avoid it. Impulse control disorders, you've probably heard about. These are where you can't control your actions. And, commonly we think of this in terms of maybe gambling or spending money too much, some sexual acting out, but it can also manifest on the road. You can be impulsive and just cut in front of people. So if you have any of this, that could put you at risk. And then, of course, the sleep disorders can lead to daytime sleepiness. So if you're sleepy during the day, while you're driving, that's obviously not a good thing. So, think about which of these symptoms, and I summarize that here, that motor symptoms, including motor fluctuations and dyskinesias, can increase your risk. Cognitive impairment or dementia, hallucinations or delusions, impulse control disorders. If you're severely anxious, if you're angry, you shouldn't drive. And then there were visual perceptual deficits in Parkinson's, we'll get into a little bit later. But there's deficits in contrast sensitivity, your ability to see different contrasts, and that might lead to problems seeing obstacles or things on the road. So contrast sensitivity. And then you can have a variable response to medications, wearing off and dyskinesias, and then the daytime sleepiness. So these are some of the symptoms in Parkinson's that might lead to an increased risk of driving. Okay, but let's go into some of the literature. This is an early paper, 2007. It was a prospective study of 40 patients with age-matched controls, and they did driving assessment with a driving simulator, and also on-road tests and evaluations of cognitive performance. And what they found, that the 4 variables in this study that predicted fitness to drive were disease duration, clinical dementia rating, if you had cognitive impairment, and the motor part of the Parkinson's rating scale. We make you do this rating, this evaluation, but also contrast sensitivity, and that's shown in the figure, that the ability to distinguish contrast. So this is actually a formal part of driving evaluations, testing your contrast sensitivity. It turns out that the retina actually uses dopamine, so there can be effects in the retina in terms of your vision. Okay, and here's a subsequent study. This is a review, actually, where they reviewed 25 studies in the early 2000s. There were on-road studies, and there were a good portion of them were prospective, meaning that they weren't just asking history questions. They were looking forward. They would have them participate in the study and then see how they did over some time. The studies mostly evaluated cognitive functioning, and then the contrast sensitivity we talked about. The trail making test is a neuropsychological test that's part of, it's actually part of the MOCA, but it's a part of most formal neuropsychological testing. And it's a test of visual attention and the ability to switch tasks. So, if you're driving, you have to have good visual attention. You have to be able to switch what you're looking at, paying attention to. And so it turns out that this trail test is a predictor of poor driving performance. The functional reach test is actually something that I published on a paper about as a measure of balance, but it turns out that it is also, so measures of balance, and so imbalance can be a risk factor in driving, which may surprise some people. And then they also found that your off score, when you're off your medicine, how are you, is a predictor. And also, do you have a good field of view? Are you able to turn your head and be able to see the traffic? So these are probably all predictive of trouble driving. And here is another subsequent study. I'm going sort of chronologically in some of the studies that have come out. But this looked at the incidence of car accidents in Parkinson's, and they were correlated with age, which isn't so surprising, right? We all do have to stop driving at some age, but also the duration of disease, how much medicine you're on, how much levodopa you're on, and then the cognitive functioning. So these were all clinical findings useful for predicting driving problems. And then finally, a subsequent study. This was a really comprehensive study of 100 patients, And these were patients who were experienced drivers who didn't have visual problems. And they evaluated the predictors of whether you passed or failed the driving test using a statistical technique called logistic regression. And what they found here was that the most significant was that trail test, which is again your ability to shift focus and change what you're focusing on, and also the visual problem, the contrast sensitivity was predictive. So I think you're getting sort of the picture that there's some common threads to these studies over the years. Here's a consensus statement. And one of the really important points of this consensus statement was that physicians, including movement specialists, that our ability to determine whether your fitness to drive is overestimated. And we should all take that very seriously. So certainly you come in and you see your neurologist and they may ask you about the driving, but we're not really that qualified to determine fitness. I mean, we understand the risk factors, but we have to get some other help to determine the fitness. It's not just us that can make the decision. So this is interesting statistic that 7 out of 10 PD drivers in one study that were approved by a neurologist failed their on-road driving test. So that's a little bit scary, I think, to all of us. So the recommendations from this consensus statement was that people with low scores, in other words, they didn't have many symptoms on the Parkinson's rating scales, people that were young, and young keeps getting older as I get older. 75 is young, right? Or below 75. And who were on low doses of medicine should still have some baseline driving evaluation, at least to consider it. There's no harm in doing it. If you're safe, you're going to pass the test. And a lot of these driving evaluations aren't really to say whether you should drive or not, but they're to maybe make modifications in how you do things, give you tips. It can be driving therapy, and also maybe that recommendations on restricting driving to maybe just local areas or daytime driving. People with severe visual problems obviously should only drive during the daytime if you're having visual problems, and that goes for people without Parkinson's. For people with more advanced disease or cognitive impairment and impairment on the contrast sensitivity, the recommendation is that they should stop driving. So if the cognitive impairment is significant, you should stop driving. In between drivers should have a driving evaluation and start to plan that you're going to restrict your driving or eventually stop your driving. Okay, so this is a checklist that I'm going to put in the chat. If I can find it, I'll find it at the end. That I'm going to put these checklists in the chat, so you should be able to download them. So the first is, let's go through each one of these. Think about yourself. Be introspective about this. Do some of these, is this you? Do you recognize this in you? So are you getting lost when you're driving? Do your friends and family say they're worried about your driving? Does it seem like other cars just seem to appear out of nowhere? Do you have trouble seeing the signs, reading the signs in time to respond to them? That could indicate a visual problem, but also a reaction time. Are you able to see the sign and get it and register what it says and then react to it in time? Do you feel like other drivers are driving too fast? Well, I have to say that I agree with that. People are driving too fast. But if it's out of proportion to what's going on in the reality, then consider that. Are other drivers honking at you a lot? Do you get stressed when you're driving? That's a sign that maybe you're having problems. Are you feeling tired? Have you had near misses? Near misses are really near hits, right? So have you had some near accidents? Do busy intersections bother you? The left turns, left turn is a challenge, more so than right turns, obviously. Do they bother you? Is the glare from oncoming headlights bothering you? Do you have side effects from your medicine? Does it make you dizzy or drowsy? Do you have trouble turning the steering wheel? Maybe you have a lot of stiffness or tremor even, and it's affecting how you do the steering wheel. Do you have trouble pushing down on the brakes or the gas pedal? So people with dyskinesias of the foot, if it's the right foot, it can affect how you affect the gas pedal. Do you have trouble looking over your shoulder when you back up or and looking to the side to see if cars are on either side of you? That could reflect neck stiffness. Have you been stopped by the police for driving? Do people no longer accept rides from you? That could be a sign. Are your grandchildren allowed to drive with you? Do you not like driving at night? And are you having more trouble parking? Think about this. Be introspective. Let's give some driving tips. So let's say you are driving, but you're noticing just a little problem and you've maybe passed the driving test. You should take account for these driving tips. When you should plan your trips in advance. When are you going to leave? Leave time so that you're not going to be speeding on the roads. Know how you're going to go. Know which roads you're going to use. Avoid heavy traffic, poor weather, high-speed areas. Wear your safety belt reliably and correctly. It really does reduce the impact of a crash. Drive at the speed limit or close to the speed limit. It's unsafe to drive too fast, but it's also unsafe to drive too slow. If you're driving slow and cars are like trying to get around you, that creates an unsafe situation. Be alert, don't be distracted, don't be holding your cell phone or eating while you're driving, obviously. Keep a safe distance between you and the car in front of you. One guideline is about 1 car length for every 10 miles per hour. Don't tailgate people. It's not safe and it's disrespectful. Be extra careful at intersections. People are going in all different directions, right? Use your turn signal. Warn people you're going to turn. Check your blind spot. The blind spot is where the retina has a hole in it, so you can't see. So many cars now, the modern cars, they'll check your blind spot for you. Or if you put your blinker on, it'll tell you if there's a car next to you. So frankly, I do that all the time. Even if I don't think anybody's around and I'm going to check lanes, I use my blinker because my car warns me if there's a car there. Don't drive if you're feeling drowsy or angry. Don't drive when you're angry. And obviously, don't eat, drink, or use your cell phone while you're driving. Take care of your car. Make sure you're not running on empty. Have a good tank of gas. Have your car serviced regularly so it's in good operating condition. Keep your windshield and mirrors clean. You want to, if we already talked about that there can be some visual problems in Parkinson's, including contrast sensitivity. Well, hopefully nobody's driving with a windshield like this, but even if it's not as dirty as this, you need to be careful. Replace your windshield blades when needed. So really take care of your car, keep it safe. And then this is the most recent study. This was a recent article that came out, 2023. And what they're recommending is that now all of you hopefully have a PD specialist. So that's already in the second line evaluation. If you have cognitive problems, that should be being addressed by your Parkinson specialist with neuropsychological assessment. And again, if you have cognitive problems or dementia, that's a contraindication to driving. Ophthalmologists are involved. There can be, to fix your vision if it can be fixed, to assess you for visual problems. And then there's a driving rehab, usually occupational therapist, that can evaluate you as well. So if you're determined as you're fit to drive, and that might include this practical driving assessment, including an assessment on the road, then we should still reevaluate you as things change. One of the things we have to face is that Parkinson's is a progressive disease. So it's not like, let's say you had a stroke, that's a sudden, change in your condition, but it shouldn't get worse over time unless you have another stroke. But with Parkinson's, it's a changing baseline. Your disease is advancing. So as your disease advances and you have more symptoms, we should do reevaluations. But if you're unfit to drive, then you should cease driving. You may want to, have some driving rehab and have a reassessment. But if you can't pass the driving assessment, then you should stop driving. So what do we take into account? We're looking at disease history. Again, above age 75 should be evaluated. The disease duration. We look at your driving history. If you're having sleepiness or sleep attacks can happen in Parkinson's, that's a contraindication. Again, like neuropsychiatric symptoms, agitation, hallucinations, delusions. If you're having a delusion that you're being chased by a car and it's not real, obviously that's not a safe thing. Motor fluctuations, and then we do our motor assessments, including the balance test. We do cognitive assessments. Mostly we're doing the MoCA test as movement disorder specialists, but some sort of cognitive assessment and then a visual assessment. So this all goes into it. So how do I evaluate? So again, I'm recognizing that physicians are known to overestimate your driving ability. But I do ask at every single visit, while I'm looking at the facial expression of the partner, seeing if there's a smirk on their face, because that could indicate that the spouse is, maybe they're embarrassed to talk up or they're reluctant to because their partner, doesn't want to lose their ability to drive, and they've already talked about it, and they said, don't tell Dr. Grill or your doctor that you're having trouble driving. So I always look at the partner's expression as I ask the question. And if there's a smirk on the face, I get into it more. I often ask if the grandkids are allowed to drive with you. And if they're not, that's a really good sign you should stop driving. I also administer the Epworth Sleepiness Scale. This is a estimate of how sleepy you are during various activities. And there's a driving subscale. So if you have even a slight chance of falling asleep while you're driving, then until that's fixed, you shouldn't be driving. I do the Parkinson's rating scale on everybody. I assess their balance. I ask about their activities of daily living, and that's part of my evaluation, and including a cognitive evaluation. And so what do I recommend? If the family is concerned, that's a sign, that's a pretty strong sign to me. They've driven with you and they're saying, no, he's really swerving. He's not stopping in time. He's driving too slow, whatever, or she. If the family is concerned, then what I usually do is I say, stop driving for now, and let's get a formal driving evaluation by an occupational therapist. If you're sleepy while driving, you should stop driving until or unless we can fix the sleepiness problem. And you have to be honest with us about all of this, all right? Again, these are dangerous machines that we're operating. And so don't hide if you're having some of these problems. If there's some mild cognitive impairment, maybe not quite rising to the level of real dementia, but cognitive impairment, then some people are able to drive locally, drive to the corner store, a mile away during the daytime. That is often okay, but not driving to places you're not familiar with, not driving highways, not driving at night, not driving long distance. If there's moderate to severe cognitive problems, then it's an obvious stop driving. You're just not safe to handle the car. If there's psychosis, if there's hallucinations, again, if you have a hallucination and you see something out on the road that's a hallucination and you swerve to avoid it, then you could cause an accident. If there's severe motor problems, if you're really stiff and you just really can't handle turning the wheel all the way, or if you're having ups and downs, too many motor fluctuations, then that's a sign to stop driving. But it's all sort of on a spectrum, from if your symptoms are very minimal, then maybe no restrictions. If there's a little bit of problem, then maybe local daytime driving. But anything after that, you should have a formal driving evaluation. And if the symptoms are severe, then we can decide without a formal driving evaluation that you should stop driving. And really take the recommendations seriously. And again, that's just the same slide. Okay, one thing I wanted to point out is that the Maryland Department of Transportation, the Motor Vehicle Administration, is a valuable resource. The site maintains a list of driver rehabilitation programs throughout Maryland. Obviously, if you're in a different state, you have a different motor vehicle administration, and hopefully they maintain this list. So, look up mva.maryland.gov where you renew your license, and you'll find the place about safety programs. So really, take advantage of this. And then let's talk about alternatives. So I did some math. I did some calculations about the economics of owning a car. And according to the American, the AAA, the AAA, owning a car costs on average almost $12,000 or almost $1,000 a month. So there are depreciation costs, finance charges, fuel costs, insurance, and maintenance, and probably some others. So cars are actually, we take it for granted, but they're fairly expensive to run. And so if you have a partner and you have two cars, and maybe you shouldn't be driving so much, or you shouldn't be driving at all, then maybe get rid of one of those cars. You sell it, you take that money, and you save a lot of money. And then you think about other options. So in Howard County, we do have a lot of options. RTA is a service that will take you to medical appointments for very low cost. Neighbor Ride is something that we have in Howard County. It's a group of volunteers who volunteer to drive seniors to appointments and to different places. So those are pretty nice things to take advantage of. And I'll tell you that I know a lot of volunteers. They really love it. They enjoy doing it. You actually make a friend. So, think about that if you're in Howard County. And I don't know if there are probably some other similar ones in other counties. And then ride share or ride services, like Uber and Lyft. These cost about $10 for about a 5-mile ride. So think about it. If you live where you live and maybe you're going to go to the senior center once a week and it's, within a few miles, or you're going to go meet some friends for lunch occasionally. And if you do 2 rides a week, then that averages out to be about $1,000 a year. And remember, owning a car is going to cost you $1,000 a month. So, and with these ride services, they're there in 10 minutes. They're there in 5 minutes. They pick you up at the door and they drop you off. You don't have to worry about parking or paying for parking. Both of the ride services, they have, if you specify that you have a walker, then they'll give you a ride that can handle that. And I've witnessed it with a family member. These Uber drivers and Lyft drivers, they're very courteous. I watched them put a wheelchair in their trunk with a smile, and they really can be very courteous. So think about this. Think about the reality of saving money, and then it's like you're a star. You get driven wherever you want to go. So think about the alternatives. So in summary, and we're going to open it up for discussion. Driving impairment is a problem in Parkinson's, and we have to face that. We have to be honest about it. This is if you're driving and you shouldn't be, you're a danger to yourself, to your passengers, and to other people on the road. So and there comes a time when we all have to start driving. I'm going to share a personal anecdote. My mom when my dad was 92 years old, bought him a brand new car. And my dad was already having a little bit of memory problems. And I looked at my mom and I said, "What are you thinking? Buying him this brand new car when we knew that he really should be stopping driving." And so he got to drive it once before it was very clear he shouldn't have been driving. So anyway, but we need to address this problem routinely. Think we just, again, if you're my patient, we talk about it every time. But the reason we have to do it routinely is that Parkinson's is a progressive disease. So you're changing, and unfortunately, the disease progresses, and at some point it may indeed interfere with driving. And really important for me to recognize and for you to recognize is that physicians underestimate driving impairment. So our threshold for getting further evaluation should be relatively low. And we have to have this discussion. And believe me, I've had this discussion many times, and it's difficult. It's the perceived loss of independence, the perceived, loss of self-esteem. But we have to get over that. We really have to get over that. And again, like we talked about, there are alternatives. So it really is not a loss of independence, and it really shouldn't be thought of as an effect on your self-esteem. Okay, I mean, things are what they are, and if you can go out there and get to where you want to go in a safe way by using a ride share or getting ride from friends or neighbors or whatever, then you're still doing what you want. You're still getting to where you want to go, but you're being safe about it. So you need to have the discussion. So I encourage those of you who are partners of patients to bring it up, and bring it up first with your partner, and then bring it up at the doctor's office that we think there may be a problem, and what can we do to further evaluate it. So when to refer for evaluation, I think we've gone over that. It's whenever there's any suspicion, and probably also a baseline evaluation. We address the loss of independence, and we should embrace the alternative transportation options that there really are. Okay, so I think I'm going to stop sharing. Are we all there?
Yep, I'm here.
Okay.
Okay, so I'm going to ask you some of the pre-submitted questions.
Okay.
You ready?
Yeah, I'm going to put something in the chat first of all.
Okay.
These are these driving tips that you should be, it's a Word document. You should be able to open it up, and it goes through the checklists and some tips. So I encourage you to take a look at that, okay?
And if you email that to me, I can put it in the newsletter next week too.
Okay.
Okay.
Well, you should be able to get a copy of it from the chat too.
Well, I'm going to try.
Okay. Technologically challenged.
I'll try. I'll let you know. The first question is, are handicap tags helpful?
Yes, you should. Oh, I should have mentioned that. Yes, if you have a walking problem, then you should get a handicap tab, and you should hang it, and you should use it so that you can get from your car in a much easier way to where you're going. Now, you should get a handicap tag even if you're not driving. So if you're driving with your partner, then they should have a handicap tag for when you're in the car so that they can park in the handicap spots. So, and again, understand that if you need a handicap tag because you have balance and gait problems, those gait and balance problems are predictive. Maybe you shouldn't be driving. I'm not saying everybody, but if you're having gait and balance problems, your driving probably should be evaluated. But I think universally, if you have if you're using a walker or even a cane, or you have fatigue and you can't walk a long distance, then certainly get a driving tag.
Okay, next question. If you think that you're still capable of driving, shouldn't you be able to keep your license?
No. If you think so first of all, you may have some cognitive impairment, so your judgment as to your driving may not be so great. But we all think we're great. We take it for granted. We look at our body and we think we're still 25 years old and that we can do anything. But there are limitations. So if your family thinks there's a problem, you need to bring it up at your office visit and get evaluated.
Okay, this is an interesting and good question. What are the legal and ethical obligations of physicians, if any, to report to the DMV Parkinson's patients who drive but shouldn't?
Right. So we do report them. I don't think we're obligated to report them, but I have reported patients that I was very concerned about that were insisting on driving.
And what are the legal and ethical obligations, if any, of persons with Parkinson's to advise their automobile insurance carrier that they have been diagnosed with Parkinson's?
So I don't know the answer to that. I really don't, but I know in terms that now I know if in terms of the motor vehicle department, you have to let them know that you have some sort of neurological disorder. And I get these forms to fill out from the MVA, and they used to have Parkinson's disease as a specific checkbox, but they took it off. I didn't think that they should have. But now it's included. Do you have neuromuscular problems or I think movement problems? And then you have to be very honest about that.
Next one. I have noticed that my depth perception has changed since I was diagnosed with young onset Parkinson's. Sometimes things appear closer than they are, and I have a hard time parking straight. Is this Parkinson's disease?
Yes, it probably is. And that might relate to the contrast sensitivity and your ability the three-dimensional vision. So your ability to distinguish things in three-dimensional space. So in one of my slides, it talked about if you're having trouble parking because of that it may indicate a problem. Not to say that this person has to stop driving, but get evaluated. Get the evaluation. Again, if you're safe for driving, then the driving evaluation is going to indicate that. And I have to say that I've been surprised. I've been more surprised in when I send people for driving evaluations that they're deemed safe when I didn't think that they would be, which is sort of the opposite of what the studies have shown. So I've had patients that I really said were thinking, not for the cognitive impairment, but for the motor abilities, that I was thinking, oh, they're probably really not going to pass. But they did. And then we evaluate, 6 months or a year later, if it was sort of, if there was a real question, then we do reevaluations.
Okay, next one. I think you've probably kind of gone over this, but still, are there specific reasons not to drive?
Yeah, and I think I did go over them. I mean, I've tried to go through, who is a safe driver, what are the risk factors. So again, look at the checklist in those driving tips that I put in the chat and go through them and say, is this me? Is this me? Is this me? And that might help clarify it. And again, it doesn't mean that you necessarily have to stop driving, but you should get evaluated. And again, a lot of times they'll say, well, we think that they're safe for local driving and continue to drive, evaluate in a year. So it's not just equivocal. I mean, it's not unequivocal. It's not that it's yes or no. There's in betweens in terms of the recommendations.
Okay, that's all the questions that were pre-submitted. Does anybody have any questions now? You can put them in the chat. Just, raise your hand down there or in the little chat box if there are any questions or comments. If not, please remember that this is recorded and will be available on the MAPS website by Friday. Yes, Michael? Friday? Yep, Friday. So you'll be able to hear Dr. Gwill. You'll hear this whole thing again. And I'm going to make another plea. We're going to send out an evaluation, and it would really help us, and we'd appreciate it if you would please fill it out. It's very short. It's painless. It's a help to us. And certainly when we ask for funding from various sources, it's just a help. So if you would do that, I'd appreciate it. And I don't see anything else. Has anybody got anything else to comment or ask? No. Wow.
Did you, were you able to download the driving tips?
I will do it later.
All right.
I saw it. I saw it.
All
So
right.
you
Maybe
need to
I'll
say,
email it to you. I can email it to you.
I should learn how to do it too. So you email it to me and I'll try and download it, and maybe I'll have it twice then. That's all.
Okay. Fair enough.
Okay. Is that it from everybody? Thank you. The evaluation will go out this evening, so please be on the lookout for it. And please, 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 please take 5 minutes and fill it out. And Dr. Grill, thank you very, very much.
Okay. Safe driving to everybody.
Good night. Good night. Thank
Good
you.
night. Bye-bye.
Bye.